Hello, everyone. Welcome to the Bureaucratic Health Spotlight, where we speak with providers, subject matter experts, and other key players in the field about the various aspects of worker wellness that are affecting you and your company today. Today, we're joined by two office health and ergonomics experts to discuss training, technology, and more. Bureaucratic Health published a case study exploring a company that was able to practically eliminate the need for ergonomic interventions with one simple tool, the self-assessment. Our experts today, Pamela, Parchim, and Asha, Thompson, will discuss the self-assessment, the cases where ergonomic intervention is needed, and the new technology solution Office.Works, which their team has put together to handle these cases for the modern technology-focused workplace. Whether you're working from home, sat in the office, or looking to learn a little bit more, this is the episode for you. Pam, Asha, welcome to the Bureaucratic Health Spotlight. I'm so excited to have you here today. I'd love to know a little bit more about the beginning of your journey with Bureaucratics. How long have you been here? What exactly do you do at the company?
Yeah, hey Matt, thanks for having us. So I have been with Bureaucratics for 13 and a half, almost 14 years. I'm a client manager, and I really support most of our office clients in their office ergonomics programs, and just excited to talk more about that.
Hello, my name is Asha Thompson. I'm an associate client manager. I support Pam and some of our other client managers on a variety of office health and ergonomics clients, and I've been with Bureaucratics Health for 8 years now.
Wonderful. So we have a lot of experience, obviously, in the room right now. So I'd love to know, when a company is looking for injury prevention or discomfort reductions, why would a technology solution work over a provider in the workplace?
Well, I think a technology solution is really cost effective as well as convenient and accessible. For a low cost per employee, like a company's employee population can enter their portal, learn about proper ergonomic postures, best practices, workstation setup, and behaviors that can all significantly reduce their discomfort without having to schedule a time to meet with an ergonomist. The technology offers convenience of being able to find this training information at any time, at any workstation, whether they're working at home, in the office, whether it's to quickly review best practices for the workstation, checking out their workstation, read about behavioral best practices, education, stretching, movement. It's just really a login and a click away.
With the kind of training that's happening today, there's a lot of discussion about effectiveness and new methods that are being introduced constantly. What kind of training is available through online programming today? Is it fundamentally different than training you would receive in person from an ergonomist or in onboarding procedures?
Well, the possibilities are truly endless. So in terms of the training that's available via the technology, we have ergonomic training that's geared towards the office environment, but there's also education for home and hybrid workers incorporated in that training. We also have thematic videos for those clients that want to have a little bit of fun with it. That's known as our Ergo Zombies training. Some of our, current clients are familiar with that, but it's not limited to videos. We also have a resource repository that has even more videos that go beyond just the ergonomic workstation. There's handouts in there on a variety of health, safety, and ergonomic topics, and it's not limited just to those topics. Clients can request anything that they don't see, and we can develop it. And it's, not fundamentally that different from training that you would receive in person. Our providers can conduct training on those topics in person as well, if the client, wants that more hands-on touch. So we're really taking exactly that same level of care that employees can receive on site in person and bringing it right into the technology so that they have it however, they want to access it.
I'll hit you with a bit of a curveball here. Do you see that training as more effective sometimes from these personalized videos and trainings like made for specific positions, or do you think that the training itself, the customization, is really the important part?
Well, I was going to also mention some of the issues with in-person training, because sometimes when it's done in a group setting, everyone has to be on their game and paying attention, right? So you have to really get them at the right time. So if someone's distracted with thoughts of an upcoming meeting or a deadline, they're really not going to retain as much information from that kind of in-person one-time setting. And they just can't go back always and review it unless they're kind of recording that training. So it can be specialized. Maybe it's focusing on a certain area and there's everyone in that audience is not thinking of that, or that doesn't pertain to them. They're going to lose some focus. So I think having the video training is just really generalized and gets to the point of the information that anybody who reviews it needs to know. If you need basic principles of, your posture, your movement, all of that in the videos, and they can go back at any time, review it over and over again, choose a video that they want to watch that is about movement, or like, I need to know how to get up and move more. They can jump right in, rather than, what did that in-person training last month tell us about movement? I'm not sure I remember. Maybe I have the handout for it, but I know there was something that they said and I just don't remember. In the video, they can go back and find that. So I think that's where the videos, having that online and the convenience of it is really helps to reinforce and retain that information.
You both are office health and ergonomics experts that we turn to a lot when we're looking for advice. Are there any programs that office health and ergonomics have been taking advantage of with new technology solutions?
I can mention some. Well, I really think a lot of the programs are looking to technology to help run with less manual work. It also provides data analytic reporting to identify trends that might be occurring within their organization and even locations across the globe, which they may not otherwise know about or understand. But if they have that data in the technology, they can identify that and be able to mitigate any issues that they're seeing. Being able to review the data, see where maybe discomfort trends are occurring, can help a company take a proactive approach to managing their employees' comfort and reducing costs and even claims by having that oversight. So I think in general, that's where they're focusing on technology. And I know there's new things coming out and there's other things that we're focusing on, looking at maybe computer vision and how we can capture some of that information without having to go through a questionnaire. If there is a computer vision that can look at the photos of someone at their workstation and be able to make real-time corrections and show that risk, that's something we're seeing more in technology and something we're also incorporating in ours.
Along with this podcast we're doing today, in the show links, we're going to have a link to a case study that's shown kind of the effectiveness of some of these tools in the workplace. But I'd love to dive more into the terminology and some of the things that we see in there. So from the experts themselves, what is a self-assessment tool? How does it help a worker? How does it look for a worker in the workplace? And how does it really kind of identify in on those problems?
So a self-assessment is one of the first steps in a client's proactive ergonomic program. When we identify discomfort, or even before discomfort is identified, for example, if you're a new hire, a self-assessment is the tool that is going to essentially allow an employee to go through their entire workstation and ensure that it is optimized and set up correctly. It's not just a yes or no questionnaire, right? It is totally dynamic and personalized to you. So as you go through and fill out questions that pertain to each section of your workstation, we're covering your work style, your posture, seating, your desk setup, display, everything all the way down to, mobile devices and how you move them between your workstations. It's taking your input and asking you very specific questions based on your input and giving you live to-the-minute recommendations based on how you respond to those questions, so that you can learn more about ergonomics and make adjustments right then and there to your setup. It's giving you behavioral coaching. It's teaching you how to adjust your own workstation so that you can mitigate any ergonomic risk that's present at your workstation. And then at the end of the self-assessment, you receive any recommendations that will help you make improvements to the setup based on how you respond to those questions. So it is, like I said, one of the first steps in the process to, improving your overall health, wellness, and safety at your workstation. And then based on the results of that self-assessment, the employee would basically be able to move through other areas of the program as needed.
Another aspect of the case study is that next step beyond the self-assessment. When the self-assessment maybe does not address every problem as effectively as it needs to, and that's the ergonomic intervention. What are those steps that get an employee from a self-assessment to requiring an actual ergonomic intervention?
So it's possible that after you've completed the entire self-assessment, right, that there are certain areas that you're not able to optimize. Let's say, you've answered all of the questions, you've made all of the recommended adjustments that the self-assessment provides you, and you're still not able to mitigate all of the risks that are identified. You're not able to address all of your discomfort. You get to the end, you receive some, recommendations, and they don't fix everything. You're still having issues, and you'd like to, escalate the issue. The technology allows you to do that. So essentially what you would be able to do is request an assessment with a professional ergonomist who can look at those more nuanced issues that are outstanding at the workstation and make those higher level recommendations that are specific to your case and your issue.
In the case study, the company involved had 91% of cases resolved with self-assessment. Do you see that as a consistent number? Was this really kind of an outlier? And how does that approach of the self-assessment help so many cases resolve quickly over traditional, ergonomic practices?
Yeah, I think the case resolution really does vary depending on how the program and self-assessment is set up. For example, I think in this case, there's cases where clients don't want to recommend ergonomic equipment. Maybe their employees are not sitting at optimal workstations already. They don't have ergonomic equipment. And so when they go through the self-assessment, you might think that probably 90% would actually go through to a virtual assessment, not the direction that we're looking at. But in the case with our clients who had over the 90% resolution, they really wanted to support their employees working at home. Many of them didn't have home workstations, even a chair to sit on. So the self-assessment was updated to provide low-cost ergonomic solutions like a chair that could be covered by a stipend as well as other devices. So they could really fully get set up through the self-assessment. If their self-assessment answers indicated that they didn't have what they needed or that their current setup could not be adjusted to make improvements, those types of items were recommended, and then they didn't need to schedule an assessment with an ergonomist because they were able to get everything they needed. And that really resulted in that high resolution, which was great because, again, that self-assessment is that low-cost option. So the company was, providing the best support for their employees while still keeping costs low.
I think that employee investment from management is so important. And a lot of the case studies that we examine here at Ergonomics, the most effective solutions are always those ones where you see management has gotten involved and really cared about employee safety in the workplace. Before we end today, I'd love to know if you have any last comments, any final reminders about office health and ergonomics, a quick tip for our listeners to take away with them before they go.
I just wanted to add that in addition to what we've talked about today, so in addition to, the self-assessment, the training resources that we covered, the ability to request a professional assessment in those escalated cases, right, where it's absolutely necessary, those proactive tools were not able to mitigate, the user's issues. There are other resources available beyond what we've talked about, like exercises. So I think that's another useful aspect of the technology that's kind of an unsung hero, if you will. It doesn't really get enough shine. And kind of going back to your question about what's fundamentally different between training, in the portal versus training in person. If you're doing like a in-person lunch and learn or a webinar training, a lot of times you'll see the providers do stretches and exercises, demonstrate them. They'll want to get people up and moving during an in-person lunch and learn or a webinar. The stretches and exercises they're teaching during those are pulled exactly from the exercises portion of this, the technology. So it's just a really cool section of the application that I wish people would visit more. And I'm excited that we're kind of showcasing it in the new Office Works. And I hope that people visit that section more, because it's another great proactive tool. When you go through the self-assessment and if it recommends like micro breaks, when you're doing your micro breaks, that's, something that you can do during a micro break. Visit your exercises section, do some exercises and stretches. So
yeah, I can add the technology is really designed to empower the employee to take care of themselves, to give them the tools and the education that they need to make the changes right away. Proactively, when they come upon a new workstation, when they're in a new environment, they switch offices, they find themselves at home now. In that changing environment, they need the tools to be able to help themselves right away and not wait until they start feeling discomfort and then report it to their employer and then try to get things fixed when they're already dealing with some of that discomfort. And sometimes it's frustrating to go through that. So being able to have that tool that they can access and be able to take care right in the beginning, even as a new hire, to come in and really understand how to set up their workstation for success, they're going to feel better when they're working. They're going to feel more productive. They're going to feel happier because they're not experiencing discomfort and frustration with how things are set up or how they're feeling in their chair or how their keyboard is too small for them or whatever the circumstance is. So that technology tools are just really important in keeping claims and discomforts away and keeping your employees happy and productive and really retaining your employee population. So just highly recommend that this would be taking on this technology, using it for your organization, for your employees is also not only going to empower them, but feel like they're cared for, that companies care for their employees because they're providing them with this great resource and benefit.
Pam, Asha, thank you so much for joining us today and giving us a little insight into not only the space of office health and ergonomics, but also this new technology, Office Works. If you're looking for more information from Relax Health, please check out our website, www.relax.com, and look in the show notes today for a little bit more information on this case study that we talked about and where you can read it for yourself. Pam, Asha, thank you so much for joining us today on the Spotlight, and we're so glad to have had you.
Thanks for having us.
Thank you.